Hi everyone, Dr. Hall here. I'm going to go through the intestines with you today. So I've started with my large intestine. I also have a big loop of small intestine ready to go, as well as lots of arteries, some epiploic appendages, and some Taenia coli, and what are going to be our veins. And I'm going to use purple because these veins are part of the hepatic portal vein system, not part of the general or systemic circulation. So our large intestine is one big, long, continuous tube, named the large intestine because of its diameter or caliber is wider than that of the small intestine, as you can see. The first part is the cecum, this part right here. This is the right side, of course, of the patient. And off of the cecum, we're going to find the appendix, or otherwise known as the vermiform appendix, sticking off of the cecum. Then we have the right side of the colon, or the ascending colon, the transverse colon, descending or left side of the colon, sigmoid colon is the squiggle part. Then we go into a widening called the rectum, and then we have the anal canal finally. So the large intestine has some interesting features on it, some accessories or bling, if you will. One of those is a band of smooth muscle that is kind of like racing stripes that goes all along the outer surface of the large intestine. Looks like I didn't make that quite long enough. So just imagine this goes the entire length of the large intestine. And there are actually 3 of these. Oh, and they keep breaking. Right? So located circumferentially around the large intestine. And these are the Taenia coli. Everybody keeps breaking. All right. Taenia coli. So there are 3 of them circumferentially around the large intestine. And so the Taenia coli have longitudinal fiber direction. So the fiber direction is going this way. So when they contract, they're going to kind of pooch the large intestine into sections. So when we look at the large intestine, we see these little it's kind of pooched in, almost like a little bit like beads on a string, kind of, but not quite. They're a little bit narrower than that. It's a little bit hard for me to do. Okay, so we have these kind of outpouchings all along the colon, and those are called haustra. So that's a haustra, that's a haustra. Okay, and it's very characteristic physical appearance of the large intestine to have that. The other bit of bling or accessory that we're going to find on the large intestine are the epiploic appendages. And these are little bits of adipose tissue that, I don't know what purpose they serve, but they kind of make it look pretty. Little bit of bling or decoration here for the large intestine, those epiploic appendages. Okay, and I'm sorry I don't have enough white to bring the Taenia coli all the way down, but in real life they extend the entire length. A couple more features of the large intestine. So you can see these corners here and here. So those are the flexures. So this one can be called the right colic flexure or the hepatic flexure, because of course the liver is up here. And this one can be called either the left colic flexure or the splenic flexure. So we've got the basic features of our large intestine. We went through the regions of the large intestine. Now we're going to give it its blood supply. I'm going to start with the most posterior structure, and the most posterior of the blood vessels is going to be the inferior mesenteric vein. So the inferior mesenteric vein, you might recall, drains up into the splenic vein, which is then going to join with the superior mesenteric vein and become the hepatic portal vein. I'm going to move this over a little bit. So the inferior mesenteric vein is receiving blood from the left side of the colon. Okay, so we've got some branches coming in here. You don't need to learn the names of the branches. But so the most posterior structure here is going to be our inferior mesenteric vein. Okay. Now, we need arterial blood supply to the colon. So we are going to have, you guessed it, the inferior mesenteric artery. The inferior mesenteric artery is relatively small, comes off the aorta quite inferiorly, and it's going to travel out towards the large intestine, and we're going to see several different branches. So one that's going to kind of travel up this way towards the left side of the colon is the left colic artery. Then we're going to see some other arteries, several of them, coming out toward the sigmoid, and those are going to be the sigmoid arteries. And then finally, there will be, those are my sigmoids, there will be one last artery. I like to think of it as the last person to get off the bus, and that is the superior rectal artery. So we have our inferior mesenteric artery with the left colic artery, sigmoid arteries, and the superior rectal artery. Now, we still haven't supplied the rest of the colon with blood. So it turns out that the rest of the blood supply to the colon is going to come from the superior mesenteric artery, which is coming off of the aorta quite high up, just below the celiac trunk. And the superior mesenteric artery is going to travel down this way and send off a branch here towards the cecum called the iliocolic artery. There's going to be another branch that comes off this way, which is the right colic artery. And then another one that comes up pretty high off the superior mesenteric artery, which is called the middle colic artery. So, superior mesenteric artery, the first one is the middle colic, and we're going to identify these by the places, the parts of the large intestine that they are traveling to. So the middle colic is going to travel to the transverse colon. The right colic is going to travel to the right colon or ascending colon, and the iliocolic, and be careful, everybody wants to call it ileocecal, but the iliocolic is going to come down to the cecum. All right, so that's the large intestine and its blood flow. So it'd be like, now Dr. Hall, what about the small intestine? So interestingly, the small intestine starts, of course, with the duodenum coming off the pylorus of the stomach. And that is going to be coming from up here. And you may or may not remember from when we did duodenum and pancreas that the superior mesenteric artery comes over anterior to the duodenum. That's my middle colic artery. There. Okay. The small intestine then is going to, coil around in the abdomen, kind of like so, but not exactly, and end up emptying into the large intestine. So the three regions of the small intestine, we have our duodenum, which then goes into our jejunum, which then gradually transitions into the ileum. So how is the small intestine getting its blood supply? So the small intestine actually is getting its blood flow also from the superior mesenteric artery. There are multiple, I'm just going to move this out of the way for the moment. There are multiple arteries coming off of the superior mesenteric artery and traveling towards the left. There's about a dozen of them. And these are called the intestinal arteries. And these intestinal arteries are traveling out and supplying the small intestine. I'm going to do a separate section to show you what that looks like in just a minute. The right side of the colon, which is receiving branches off the superior mesenteric artery, and the small intestine are going to drain into the superior mesenteric vein, right? And the superior mesenteric vein is going to travel up posteriorly, right? Join with the splenic vein to become the hepatic portal vein up here. So they do run together, the superior mesenteric vein and artery, when we are down here in the colon, whereas the inferior mesenteric vein and artery do not run together. They are in slightly different places. So I'm going to stop here and do a magnified view to show you the vasculature of the small intestine in part 2.